Thank you, Matthew. That's a great way to start. And good morning, supervisors. Good morning, community. Matt Willis, Public Health Officer, with a COVID-19 update for June 15th, our reopening day. And I'll borrow, if I could have my slides, please. I'll offer an update on our current status and then talk about what the future holds for us. Next slide, please. So this is our current status where we are today. When the governor announced, 10 plus weeks ago that we would be reopening on June 15th, frankly, as an epidemiologist and as an infectious disease doctor, I was a little skeptical about whether or not that was a safe prediction to offer that far out, given how unpredictable this pandemic has been. It happens that it was almost perfect timing for us as a community. This weekend, for the first time since the beginning of the pandemic, or at least for more than a year, we had 0 people hospitalized in Marin County with COVID-19. Our case counts now, for the first week that I've been presenting to you, are less than 1 case per 100,000 residents per day. And our cases we have now 0.8 cases per day. And our cases among our Latinx residents are about half of that. And we have had no cases among African-American residents in the past week. Marin County resident deaths in the past month have been 0. We've had 1 person pass in a Marin County hospital from COVID-19. That person was a visitor who was unvaccinated, but we've had no Marin County deaths in the past month. 89% of our eligible residents, those 12 and above, have been vaccinated with at least 1 dose, and 80% of those who are eligible in Marin County are fully vaccinated. These facts, these data points that I'm sharing with you are connected. The reason our case counts are as low as they are, the reason our hospitalization rates are down to 0, the reason we haven't had anyone die in Marin County among our residents in the past month is because vaccination rates. 98% of our residents above age 65 have been vaccinated. That was the population, that was our group that was most at risk for death. 92% of our deaths were among our residents age 65 and above. So the success of our population, of our community, of stepping forward, especially with regards to vaccination, is really why we're able to, and I'm able to safely say, as public health officer, that we are prepared to reopen today. Next slide, please. This is our pandemic experience in terms of the daily cases. This is our epi curve in the beginning when we were talking about flattening the curve. This is that curve, and you can see that it is now close to flat there at the far right. Our data now is similar to what it was at the beginning of the pandemic. The difference between where we are now versus the beginning of the pandemic is that we are protected as a community through vaccination. At the beginning of the pandemic, we were all still susceptible to this novel virus. Next slide, please. And this just shows the 0 hospitalizations that I've been sharing this data with you on a weekly basis for the better part of a year, and that's the first time I can remember that number being 0. Next slide, please. This is our case rates by county compared to other counties in the state of California, and Marin has the 3rd lowest case rate in the state. Next slide, please. This is our dashboard that shows our vaccination rates and highlights the data I just shared with you. 199,053 of our residents, of our 255,000 residents countywide, have been vaccinated with at least 1 dose. Almost reaching that 200,000 mark, hopefully by tomorrow or the next day. Next slide, please. And this shows that Marin County still remains the most highly vaccinated county in the state of California, and is indeed one of the most highly vaccinated counties in the nation. Importantly, for our own security and safety, 9 of the top 10 most vaccinated counties in the state of California are Bay Area counties. So we are fortunate to be embedded within a well-protected region, which is important because there's regional travel. People work in one county and live in another. And it also is a sign of how fortunate we are and how fortunate I feel to be part of a community of public health practitioners in the Bay Area that was part of that first shelter in place back in March 15th of 2020, before really the first shelter in place in the nation, responding to the novel virus that was just starting to emerge in the Southern Bay Area at that time. Next slide, please. Now this is our vaccine strategy. This is broken down by town, and we had set a goal that we want to make sure that no community in Marin is left behind. No community is more than 10% lower vaccination rates than the county average. And what this shows is that if you look at each city and town and each population group in Marin County, all are within 90% of that total county coverage. We have certain pockets, especially race and ethnicity groups that we do need to continue to work with strategically to try and increase vaccination rates. But as a community, all communities in Marin County are within 10% of the average. Next slide, please. This is vaccine progress by age group. Again, 98% of our residents age 65 and above have been vaccinated. 92% are fully covered with both doses, and shows that our youngest cohort, our 12 to 17 year olds, about 76% have been, or 77% have been vaccinated now. And that's the highest rate for that age group also in the state by a significant margin. Next slide, please. This is our vaccine progress by race and ethnicity. We have always taken a racial equity approach to our pandemic response. Every opportunity we had, recognizing the reality of structural racism as it's manifest in our county and across the nation. Our rates among our Hispanic Latinx residents are actually our highest rates for vaccination rates of any group in Marin, and that's matches the burden and the experience, the differential experience of COVID-19 infection risk and events in that community. 72% of our Black African-American residents have been vaccinated. That's in comparison to closer to 32% nationwide for a racial and ethnic group that has been historically marginalized and has understandable issues in terms of trust. And we are working with our community leaders, community-based organizations, faith-based partners to help increase vaccination rates and offer the protection of vaccine for every community in Marin. Next slide, please. This is a concern, as much as we want to celebrate and be honest about how well we have done as a community and how we are prepared to reopen. It's also important to lend the word of caution. This is a global pandemic. The pandemic is not over. One of the concerns as this progresses globally is the emergence of variants in places like Africa and India and other places where it's really not under control very well at all. In fact, in many cases, case rates rising. There's more and more mutations and opportunities for variants that could then spread globally, especially if those variants, the vaccines that are available do not cover those variants. So this is one picture, one glimpse of that for us in Marin County, which is the Delta variant, previously known as the India strain, is increasingly prevalent in Marin. This shows over time, as we've been sequencing variants since the beginning of the year, that now about 70% of our cases in Marin County are that Delta variant. That is a variant that is more infectious. It's more contagious than the UK strain. It may be also more virulent, so it may actually have higher risk for hospitalization and death. The reason that we're not seeing widespread transmission of COVID-19 in our community, despite the presence of the Delta variant, is because of vaccination rates. This is a variant that happens about 88% protective. Our current vaccines are about 88, 90% effective against this Delta variant. And that's why when we have clusters of cases, in Fairfax and in Selma, there was a cluster in May. There was a school-based cluster more recently of this Delta variant, but those cases rose and then died over a period of a week or two. And that's because when those people are encircled by others who are vaccinated, that's herd immunity, and it prevents the virus from spreading further into the community. So the reason we're seeing control, despite the presence of the Delta variant in Marin, is because of high vaccination rates. Next slide, please. So public health orders after June 15th, as you know, the blueprint regulations have been retired as of today. I don't know exactly what time, probably noon, but it's now. All sectors are now open, no capacity limits, no social distancing requirements. So all of the tiers, the color framework, the weekly announcements in terms of which tier we're in, that's no longer going to be happening. The entire state is going to a single framework, but the state orders are really limited to facial coverings, mega events, which don't really apply within Marin because it's 5,000 indoors and 10,000 outdoors. And we don't have venues that host that number of people in Marin. And then school settings, and CDC is offering some guidance around schools that will probably be brought into our state order. And then Marin County COVID-19 pandemic orders have been rescinded into effect today. The only order that is a local public health officer order is around isolation and quarantine. And that's basically an order that would require anyone who is diagnosed with COVID-19 to isolate from others who are not infected, who are susceptible in order to control transmission. And that's an order, that's a public health power that exists for other communicable diseases as well, tuberculosis, measles, et cetera. So we're just bringing COVID-19 in line with that practice. Next slide, please. Settings where everyone must still wear masks. I think the mask questions have been the most confusing, frankly, as the regulations have been changing at the CDC, the California Department of Public Health, and Cal OSHA. So I'll do my best to summarize and simplify for our community. So these are settings where everyone must still wear masks, right? Regardless of vaccination status on public transit. So that's, planes, trains, buses, taxis, and then places where public transit occurs. So airports, transit hubs, et cetera. Indoors in schools, importantly, so K through 12 schools, still everyone is covering their faces, including childcare and youth programs. In healthcare settings, both patients and staff are continuing to cover their face regardless of vaccination status. So hospitals, clinics, long-term care facilities. And then correctional facilities, our jails and prisons, also everyone, again, covering their face. And shelters. So when we think about, cooling shelters that we might have to start opening as the weather gets warmer, or any other emergency shelters, those are settings where people will be covering their face regardless of vaccination status, both residents and staff. Next slide, please. So these are options for businesses. As we move into the next stage, the governor and the CDC, as we move forward with the June 15th, California Department of Public Health is aligning with the Centers for Disease Control, the CDC recommendations that people who are fully vaccinated need not cover their faces either outdoors or indoors in terms of their general public. So for businesses, you have some choices, either the honor system, and this seems to be the sort of emerging as the most likely or the most common practice, but is voluntary, using an honor system. So providing information to all guests and allowing vaccinated individuals to self-attest compliance. So making an assumption that if someone is not wearing a mask in your business, that's because they are vaccinated. Or implement a vaccine verification process to determine someone would be required to wear a mask before they come inside, or simply require all patrons to wear masks, knowing that you may not be able to determine who is or who is not vaccinated. In Marin County, with 90% of our population vaccinated, we are better equipped than almost any other community to make that assumption, but this is obviously an option for businesses to simply require everyone wear masks, and businesses are completely allowed to do that. And if you're unable to comply with that as a patron, you would have to find another business to patronize. And then, of course, obviously, no person can be prevented from wearing a mask. So importantly, anyone who wishes to wear a mask, and many of us will wish to continue to wear masks, both indoors and outdoors, potentially, it's a personal choice. It doesn't hurt anyone to wear a mask, and no person can be prevented from wearing a mask. Next slide, please. Cal OSHA regulations. So we are in a funny moment here where it's probably about 48 hours before this might change, but this is where we are right now. Currently, all workers remain masked indoors in any public setting, because unless you can be sure that all of the public in that setting are fully vaccinated, all workers remain masked indoors in any public setting, and that includes retail. And then any group of employees, if not all are vaccinated, everyone would still need to cover their face indoors. However, we anticipate that on Thursday, so June 17th, a revision. The Cal OSHA will be meeting. most likely, and we're hearing signal that it is more likely to align with the CDC and California Republic about guidance for the public that I just shared with you, where people who are vaccinated need not cover their face indoors. And that will be, either through executive order by the governor or through Cal OSHA. So stay tuned on that one. Next slide, please. So with all of this good news, we also want to be realistic about the fact that this is a local experience. What I'm describing is a phenomenon of local control based on the privilege that we've had to have access to vaccines, and then everyone's good work in our community for choosing to be vaccinated, and also all of the excellent practices along the way, facial covering, social distancing, that have allowed us to really control this pandemic in our local experience. However, cases are still rising regionally. New variants are emerging. The global vaccine rollout has been slow. In some, many countries, less than 10% of their populations are vaccinated. There are low vaccination rates in some states due to hesitancy. We're seeing a massive oversupply of vaccine now in the United States, partly because there was an overestimate of the interest in some areas of the county. And so now of the nation. And so they're now fortunately exporting doses to harder hit areas that don't have access to vaccine globally. We may have boosters, depending on the variants. We may need to do boosters. And importantly, remember that 56,000, despite our success, still 56,000 Marin County residents are not yet vaccinated. And that's about 24,000 people who are eligible, and about 32,000 people are littles, right? Our children who are less than 12 years who are not eligible to be vaccinated. So there's plenty of susceptible people in our community that if a variant emerges that's more infectious, we still have plenty of room for surges. Next slide, please. So for public health, our focus is shifting. We are going to continue, our highest priority is vaccinations. We are going to focus on vaccinating the remaining 10% who are eligible, aggressive outreach and education and support. Vaccinations will occur in healthcare settings and in our mobile units. An increasing number of our primary care settings, our hospitals. Your regular doctor now has the ability to find a vaccine for you or to offer it there within their own setting. And then we have mobile units who are traveling around the county on a regular basis to try and reduce any barriers to access to vaccines. We'll also be continuing to focus on testing, again, because the virus is still present in our community. We know that we'll have cases, and the only way we'll be able to detect surges in cases or the emergence of variants is if people, when they are experiencing symptoms of COVID-19, do seek testing. We have relationships with laboratories to get the whole genome sequencing we need now from every test that occurs if it's positive. Unvaccinated employees in some high-risk settings will still be required to be vaccinated under state orders, and that might apply to schools and correctional settings. And we're waiting for the California Department of Public Health to clarify those orders. And that testing will be happening through healthcare and mobile units. We have plenty of testing options countywide for free. Public health will continue to closely monitor for case clusters and variants. Again, we have relationships with laboratories now where we're able to do that whole genome sequencing we need. And then our team is now really well versed in contact investigations. We now have, because we have fewer cases, we're able to really do the deep dive into each case to determine who they may have exposed, to interrupt chains of transmission. So we're working on our contact investigation for early detection and isolation. And then we'll continue to be offering communications and messaging to the community on an ongoing basis through our website and other forums, albeit not as frequently with you on Tuesday mornings. Next slide, please. I just wanted to share this. This is Dr. Amit Rajpari, our head of psychiatric services for the county, shared this with the executive team yesterday. And I thought this was just an apt analogy for us as a community. And this is the Japanese art of kintsukuroi, which is repairing broken pottery with gold. I just want to acknowledge the year that we've had, the year plus 15 months, the loss of lives, the loss of livelihoods, the trauma that have been experienced by everyone really in our community. Everyone's had a different experience of this, but no one has not been deeply impacted. And this just reflects that rebuilding is a creative process. It's not just going back to normal, it's building something new, something better. And I think, we've seen what we can accomplish together as a community. We've seen how reliant we are upon one another. Everyone has done their part. And those are lessons that I hope we hang on to. Next slide, please. So in summary, Marin is prepared to reopen carefully. Vaccinations remain our highest priority. We have monitoring systems in place. We're prepared to respond. Next slide, please. And I just want to express my gratitude as public health officer for our community as a whole. That says a lot on the left there, free masks. That was a photograph from, I think, in Bolinas. And there's my 10-year-old who was reminding us on a weekly basis that we can do it, from the Rosie the Riveter Museum. He had celebrated his 10th birthday and his 11th birthday under COVID precautions. And he just graduated from 5th grade, and we were able to gather together for that ceremony. Thank you.
Thank you, Dr. Willis. Going to bring it back to the board.